who wants to take the questions. Firstly, we have gotten reports in the newsroom that there might be some sort of shortage of medication for children under 2 years of age, such as baby cough syrups and Panadol, etc. And I just want to get some clarification of that. And secondly, I saw this morning at least, there is some reports of a zoonotic virus called Langya that has been detected in 35 people in eastern China. So now what I'm just wondering is, should we expend any energy on being concerned at this point right now over that outbreak? Thank you.
Thank you, Richard. So the issue you have raised about shortage of paracetamol and so on is in the private sector, not in the public sector. However, Richard, I'm glad you raised it, because what has happened since the start of COVID, and I have mentioned this before, countries that manufacture these drugs have placed these drugs on an embargo, meaning they are not going to export. And it goes down to even paracetamol, imagine that. What we have to do and what we have done to help the private sector and also keep our supply chains open in the public sector is through the Ministry of Foreign and CARICOM Affairs. We write to them, we engage the local embassies, we engage our missions abroad to ask these countries not to embargo supplies for countries like us. At the public sector level, and I don't think we appreciate how hard we have worked to keep drug supplies open. And I think I am on record as saying we try to avoid chronic drug shortages. There may be acute, short time, but we are at the mercy of a global supply chain that is suffering from, one, embargoes on drugs, even dexamethasone, which we have to use for COVID, and which asthmatics have to use and the arthritics have to use. That is embargoed. But we have worked diligently behind the scenes without fanfare to keep these drugs open. Prednisolone, paracetamol, as you have said, which is now short supply in the private sector. But we have supplies in the public sector. On the issue of the new virus, yes, we took note of it. And I think your direct question, should we expend energy being concerned, I will hand you over to the CMO for that one.
Well, certainly, I think if COVID has taught us anything, is to be on the alert for new viruses, especially with the way persons travel. Virus could be in one part of the world today and then in another during that same day. So it is something that we have to keep a very close eye on, look at the spread and seeing what is happening, if it is being able to spread from person to person, and then of course take the necessary steps. But through the IHR mechanism, normally countries are alerted for any small outbreaks that occur in whatever region of the world. So we await further updates through the IHR network, but it's something that we will keep a very close eye on.
Thank you, CMO.